Hello, this is Christian Spanish Schmidt, and today we're gonna have a small talk about um, knee effusions, and this is feedback in real time. I had a video from one of the residents, and I'm just sending a little bit of feedback. Point of care ultrasound is a very fast way to determine the presence of knee effusion. You would like to use a linear array probe and always point the linear array towards the head of the patient or towards the right so you know what you are seeing. The linear array will give you more detail but less depth. This is a little bit of the anatomy of the knee. Here is the quadriceps tendon. This is the patella, and then this is the patellar tendon. And here, right here, we have the suprapatellar bursa that usually is communicated to this space, same as the infrapatellar bursa as usually communicating to this space, and the prepatellar bursa that is not communicating. Then we have some synovial cavities here. And so what we're gonna see is an effusion exactly here in the suprapatellar bursa. So the video is a little bit fast, but here you can see the patella. This is the periosteum. This is echogenic shadow. This is some fluid, and right here we can see the suprapatellar tendon, and then a lot of fluid below the patellar tendon and in between the muscle, the quadriceps muscle. Now we're gonna do it a little bit more slow. So this is the patellar periosteum, you can see. Then there is echogenic shadow from the patella. Then we have subcutaneous tissue with some inflammation. You can see there is some stranding here, and all this is fluid coming from inflammation, likely from trauma. And then we have fluid here. I know it's trauma because the patient has a history of trauma. And then we have here, this is the head of the patient, and then we have the quadriceps tendon. It doesn't look perfect like a tendon should look because it's not completely tense, because most likely the knee is extended in a bed or a stretcher. There is fluid here, and this is the quadriceps muscle. This is the skin and subcutaneous tissue, as you can see. If you were to try to approach this, you would not like to go through the muscle, but you would like to go through the side, the tendon, and you would like to go through the side with the needle. Here, again, we have the periosteum, the patellar periosteum. There is a little bit of normal fluid here, probably the prepatellar bursa, and then skin and subcutaneous tissue with a little bit of edema and echogenic shadow of the patella. So this is what I have for you today, and thank you.